This is a paper co-written with Jen Rinaldi, who's sitting there for moral support, which is great. Again, she's the legal brains behind this. Don't ask me the legal questions because I don't know the answer. So this work is coming from a larger body of work around the Huronia Regional Center. What we're arguing today is that that institutions are inherently violent, and that they are inherently violent in the very DNA of their organization. And what we're arguing today in this paper, through the use of the institutional cases, which I'll get to in a minute, is that there are 4 preconditions of institutional organization that, when met, means that almost universally the conditions for violence are apparent. And in fact, I don't think we have found an institution that meets these 4 preconditions in which sadism hasn't actually come to bear within the walls of the institution. So, for example, several weeks ago, the Toronto Star published an expose regarding the treatment of former incorrigible children who had been sent to so-called strict training schools. People probably read that. These children are now older adults who have come forward with testimony of incredible abuse and deeply troubling stories of very, very heinous treatment. And what was actually shocking to me is not the stories themselves at this point in my research career, but my own reaction, which was, yeah, obviously this is the case. Because what I think Jen and I have learned is that when you institutionalize people in particular kinds of institutions, these are the stories that occur, whether they are residential schools or training schools or orphanages, or in this case, institutions for people with disabilities. So we take as a starting point the rampant and ubiquitous abuse of people confined to total institutions, institutions in which residents are confined to live, to work, and to carry out all daily activities. Understanding experiences, as we have over the last several years, we've worked with survivors of the Huronia Regional Center, and understanding experiences of living at Huronia is in many ways to be faced with the question of what happened? What the hell? How were such extreme forms of violence permitted, allowed to flourish even? So in this presentation, we're asking what organizational factors foster an institutional culture in which extreme forms of violence is not only tolerated but normalized. Otherwise stated, how does the organizational structure of total or residential institutions that have housed persons with disabilities allow and even nurture a culture of moral abdication, which leads to extreme forms of violence? And we see this happening again and again. So to address this, we're going to look first at an analysis of the institutional cases, a trend in civil litigation seeking to hold provincial governments responsible for horrific violence and neglect endured by former institutional residents. These class actions provide important insight not only into what kinds of violence many institutionalized people have suffered, but also about common organizational practices that we believe lead to profound forms of violence within institutional settings. So a bit about the institutional cases. This is, just to start, that's the Huronia Regional Center. That's where we've done a lot of our work. It's what they look like. The institutional cases were brought against the Government of Ontario for their funding, operation, management, administration, supervision, and control of institutions that served as settings for physical and sexual abuse. This string of lawsuits have laid bare in their outlining of respective material facts the extremely violent conditions residents experienced while institutionalized. So through looking at these cases, we can discern clear patterns not only of common examples of harm, but also of the institution's common conditions that structured and made possible the violence residents experienced. We looked at case law because here we find a concentration of ignored reports on conditions of care, survivor accounts of abuse, analysis of the state conditions operating at the macro level, and state defenses. In short, we find a constellation of differently positioned resources that offer the clearest picture yet of what life was like within institutional walls. And that really hasn't happened before now. We haven't had that collection of information until these cases have come out. And the picture painted is elevated through courtroom scrutiny and the public documentation given credence through court justice's censure of state inaction. Crucially, this case law conveys that there has been a host of moral agents, not just a few bad apples, as evidenced by the sheer volume of caseload and the nature of the wrongdoing alleged, situated at different levels of power, making the violence in institutionalized settings possible, and not only possible, but pervasive. So the arguments that we've heard over and over again is just a few crappy staff, there's just a few bad apples. And the idea is if you could just get those bad apples out, the institution would be fine. And what we're saying is, no, actually baked into what institutions are is violence. So that is a switch that goes off automatically once you structure institutions in particular ways. It's not about bad actors or bad apples. And actually what we're saying, I think, is something much darker than being able to point to a few sadistic nurses or a few crappy, supervisors. Marie Slark and Patricia Seth spearheaded the first of the institutional cases by acting as lead plaintiffs for a class of former Huronia Regional Centre residents. Located in Orillia, Ontario, Huronia managed the day-to-day living of persons diagnosed with intellectual disabilities. The class action reached a settlement in 2013, which included a $36 million compensation package and non-monetary damages. And that sounds like a lot, but the class actually, the original request, I think, was a billion? It came down quite a ways. The top amount that individuals could receive from this for their damages, the individual settlements topped out at, I think, $40,000, which, given the kind of enormity of violence people faced, is actually very little.
And many nonverbal survivors ended up with $2,000.
That's right. Nonverbal survivors who could not describe the abuse that they had received over years ended up with the kind of nominal amount that they were received just for being there. The Slark Settlement served as a model for two concurrent suits involving institutions for persons with intellectual disabilities, one brought by David McKillop on behalf of residents of the Rideau Regional Centres in Smith Falls, the other brought by Mary Ellen Fox on behalf of residents of the Southwestern Regional Centre in Blenheim. When Marlene McIntyre brought a class action suit against Ontario for harm suffered at the Adult Occupational Centre in the town of Edgar, and that institution is just called Edgar, the settlement reached came to encompass an omnibus action on behalf of 12 comparable Schedule I facilities, and that's the name given to these kinds of institutions. In what was called in court the fifth institutional case of its series, class representative Robert Seed settled with the state for the abuse of residents endured at the W. Ross Macdonald School for the Blind, located in Brantford. Still active, and they have not been settled yet, Christopher Welsh is suing the state for the abuse he and his class endured at the Ernest C. Drury School for the Deaf in Milton, the Sir James Whitney School for the Deaf in Belleville, and the Robart School for the Deaf in London. In what is also an active case, James Templin is suing for treatment endured at the Children's Psychiatric Research Institute in London. Across this legal history, plaintiffs detail experiences of profound violence. Commonalities include hitting, punching, slapping and kicking of residents, throwing objects at residents, sneaking up on residents to attack them from behind, the use of restrictive devices such as straitjackets, solitary confinement, and over-medication, sexual assaults, harassment and forced nudity, starvation and forced feeding, verbal abuse, and humiliation. Curative treatments were administered without consent despite the physical pain and humiliation involved, and without scientific evidence of effectiveness. The experience of violence bear striking resemblance across institutions, across geographic regions, time periods, and disability populations. And I should also say, case law was one of the ways in for us. We also spent many years hanging out with survivors of Huronia and doing multiple in-depth interviews. So our work is bolstered by very close working knowledge of kind of detailed survivor accounts of Huronia in particular. But what we do see is that the descriptions really match across the institutions in case law, but also across residential schools. I did a couple of sort of ad hoc interviews with residential school survivors, and it was as if I could anticipate their next words because I knew so closely the kinds of stories that emerge from institutions like this. But how to make sense of the ubiquity and profundity of this violence? To answer this, we've organized the structural conditions evident in the institutional cases using social psychologist Albert Bandura's model of moral disengagement. So Bandura theorizes a capacity for moral agency where social cognitive development involves adapting and enacting standards of right or wrong that guide self-regulatory behavior. He conceives of the moral compass as agential to the extent that the subject carries intentionality, forethought, and the capacities to regulate and reflect upon the self, but understands crucially this compass to be socially situated insofar as the moral subject reacts and contributes to a reciprocal interplay of intrapersonal, behavioral, and environmental determinants. This is to say that morality is situational. It's social and it's situational. It's not something deeply located in here. It has to do with what's happening here. However, this interplay does not always carry the alchemy to produce a moral agent, that is, an agent who is moral. Bandura writes about what he calls moral disengagement, moments when moral codes are abandoned. In this model of morality, Bandura theorizes that moral disengagement occurs through several linked cognitive mechanisms or cognitive shifts that allow the denial of moral agency. Here, we've refashioned these into a fourfold analysis of institutional organizational traits that foster such moral abandonment and induce what we call situational violence. So what he's saying is that morality, our general moral codes, can be turned off. It's not something that you carry everywhere, but they are situational, which again is much, much darker than pointing to a few psychopaths working within institutions. So what are these traits? The first one we've identified is, does the institution understand its inherent function as one of controlling, reforming, or refashioning residents? If those administering and staffing an institution understand their goals to be reforming, refashioning, or controlling its residents, their work from the outset has to do with imposing a normative vision of who residents are supposed to be and how they are to behave, and crucially, understand that residents are not capable of managing their own formation or development. Therefore, institutional goals of reformation, refashioning, or control indicate a particular orientation, disciplinary intervention rather than, for example, autonomy or dignity. We argue that instrumentalization of conduct stands in for moral grounds and circumvents the activation of moral consideration. Institutional conditions reorganize and reconstruct staff responsibilities to residents, to modify residents, to make them better citizens. And as long as this justification and prioritization holds, staff sidestep their responsibility to treat residents as persons. So overwhelmingly, we see this across the institutional cases, which identify the links between the call to reform and violence. The affidavits and cross-examinations invoked during the Slark proceedings refer to staff actions as motivated by punishment. For example, Seth citing being held down in cold water for refusing to eat. In the statement of claim that launched Bouchard, Fox indicates that she understood the use of a cattle shock, an electric shock via a cattle prod-like device, and timeouts in small windowless rooms, otherwise known as solitary confinement, to be disciplinary measures. Further, actions designed to control resident behavior and to reform or refashion those institutionalized to point of compliance carried from residential to educational spaces, as was evident in facilities explicitly organized to operate as schools for students with sensory impairments. The SEED proceedings illustrate how visually impaired students experienced abuse in the W. Ross Macdonald classrooms, for example, having heavy objects thrown at them for not paying attention, house parents who force-fed students who did not finish their food or eat fast enough, and inflicted physical abuse and humiliation on those who wet their beds at night or left their beds. Welsh recounts hearing-impaired students being slapped in the mouth for making mistakes when speaking orally, having their arms physically restrained in reaction to their use of sign language, and being forced to wear hearing aids even when they caused pain, alongside punishments for not eating, not staying in bed at night, and wetting the bed. These examples, where punishment was used to produce compliance in classroom and residential settings alike, demonstrate how violence was meant to be instructive, was meant to modify or redirect behavior. Violence was thus used as a tool both as punishment to produce compliant behavior for the sake of smooth daily facility operation, and as therapy to produce compliant behavior indicative of a cure, both of which are reformative ends. Trait number 2 is, does the institution operate under an efficiency or an austerity model? And I'd like to say this doesn't actually mean that the institution itself is poor, but rather that there is an ethos of austerity that guides daily management. All the institutional cases involving Schedule I facilities rest allegations of negligence in part on the state's failure to heed details of Walton B. Williston's 1971 report on Ontario institutions. The report documents institutional conditions such as substandard staff-to-patient ratios due to staff and resource shortages, overcrowded facilities, and antiquated buildings. Also cited in the 1973 Welsh report speaks to Schedule I facility residents needing additional special treatment they were not receiving. The Welsh report, for example, this is a quote, determined that not only did residents not receive the level of appropriate care required, but that since the 1960s, there had been little overall improvement in the actual pattern of care received. So again, there were calls around this in the 60s and 70s that just went completely unheeded. Notwithstanding these reports, provincial facilities did not have funding increased, did not develop oversight to prevent staff abuse, and did not improve quality of care. Residents felt the impacts to imposed austerity measures. Having to sleep in densely populated open dormitories like the one pictured, that's Huronia. was commonly featured across litigants' statements of claim. McKillop and Fox respectively recounted having to wear issued shoes and clothing that did not fit their bodies. Highlighted in SEED, the residential schools for youth with sensory impairments hired unqualified staff who did not know how to work with students with disabilities and saw their job more as sort of remedial caretakers. Residents themselves became a free pool of labor on which the institution relied. That residents conducted work related to the upkeep of the institution without pay was a commonality across the case law. As examples, at Rideau, McKillop washed dishes and floors and cared for other residents without pay, and Fox worked at Southwestern's laundry department without pay. Any skills development was directed toward maintaining the institutions themselves. The use of unremunerated patient labor was a self-conscious strategy on the part of institutional administrators and was easily justified as a form of vocational training. Insufficient resource provision was rationalized by discourses calling for a self-sufficiently run institution, and these discourses alter and normalize punitive modes of austerity. Substandard meals and clothing are rewritten then as positive modes of cost containment. Forced, unremunerated labor is rewritten as vocational training. Thus, neglect and subjugation are rewritten as care. These are cognitive shifts that facilitate moral abdication to the extent that an austerity operational model minimizes and ignores its impacts on residents. The prioritization of efficiency in institutional spaces produces in staff and state an abandonment of responsibilities around recognizing and refraining from violence. This is a quote from an interview we did of someone who was forced in Huronia to care for someone who was far more impaired than he was. He was asked to force feed this person who was not somebody who could feed himself. This person's understanding for the rest of his life was that he had killed this young person who he was forced to force feed. We don't know whether that's true or not, but certainly that's the impression he was left with over his lifespan. 1 minute?
You can have a little more.
Oh my God. All right, I will go through these quite quickly. The third trait that we argue leads to moral institution is whether the institution is socially and physically isolated. Across these institutions, we see the pattern that they are put at the outskirts, quite literally the outskirts of the margins of society. And what we argue here are that forms of isolation, whether they be geographical or social, complete removal from the rest of society, either socially or geographically, is yet another way, acts as another contribution toward institutional violence, because within spaces that are completely removed, cultures of violence are allowed to flourish without the impact of imposing outside eyes. And the final trait that we, quote on isolation, the final trait that we argue leads to moral abandonment is whether residents of the institution are socially mistrusted or despised. And what we argue here is that social forms of contempt are exemplified, made manifest, and redoubled through dehumanizing forms of bodily control within institutional settings. Within such institutions, resident bodies are subject not only to limiting daily routines regarding bodily comportment, where to eat and sleep and how to wash, but also to the whims of staff who have direct access and control over the bodies of those incarcerated. This pattern is clear across institutional cases. Residents in all cases were indeed openly mistrusted on account of disability, and in turn were denied access to control over their own lives and bodies. And what we say here is that, I'll just finish. Distrust and dehumanization operate as cognitive shifts to excuse the abdication of moral precepts. The cognitive mechanism at work changes the perception of the victim, allowing perpetrators to shift blame for violence from themselves onto the victim, or circumstances seemingly created by the humanized victim, him or herself. Violent conduct becomes a justifiable defensive reaction to belligerent provocations. Victims get blamed for bringing suffering on themselves, and that's what Bandura writes. When incarcerated populations are reimagined, given their dependencies or their disabilities, not as humans, not as persons, but simply as subhuman bodies, self-regulation in the treatment of their bodies and the management of their care need not guide or keep in check staff conduct. Further, acting out against these forms of control, or enacting embodied forms of resistance, I think Tessa's going to talk more about this, invites additional violence, which reinforces perceptions of savagery and the further need for bodily containment and constraint. So what we're arguing here in sum is that there are very specific institutional preconditions, and that when these preconditions are met, our argument is that morality is turned off, that they are cognitive shifts that allow moral compasses to be turned off, and that in the absence of morality, and in the face of larger belief systems around disability and humanization, incredible forms of violence are allowed to flourish, and indeed do over and over and over again. I think our argument is deeply against institutionalization at that front. I think that's it. Yeah.